There's a church right down here we're gonna pass.
Markeisha Hawkins takes us on a drive she knows like the back of her hand.
I know everybody over here.
Pointing out every church, farm, and home along the way.
It's gonna be on your right-hand side.
A 30-minute route out of town she's taken hundreds of times to care for her children. Her sons, Ethan and Logan, were both born prematurely. Her firstborn weighed just 2 pounds.
It was scary because I got this preemie. And for one, it's not the regular preemie. They're called micro preemies because anything can go wrong at any moment with those kids.
Logan spent weeks in the hospital and suffered serious lung complications. Markeisha knew she needed a pediatrician to care for them long term. They live in Sparta, Georgia, about 2 hours south of Atlanta.
When you were searching, when you typed in pediatrician Sparta, Georgia, what came up?
Nothing.
Not one pediatrician?
No.
Nationally, 43% of counties lack access to a children's doctor, according to data we analyzed from the American Board of Pediatrics. That's nearly 4 million children who live in counties without a single board-certified pediatrician.
Hello, how are we?
Back in Georgia, Dr. Christy Mountain Bonner is the Hawkins family pediatrician who practices in neighboring Washington County. She's the only pediatrician in private practice there, caring for about 4,000 children.
We'll be.
Some families drive nearly an hour to see her.
It scares me because in those other counties, I know there's premature births and premature babies that are needing the care. And sometimes I find in rural communities, there are issues with transportation. There are issues with finances to fund transportation.
A study published by the American Academy of Pediatrics in December reveals a compounding problem. More hospitals are dropping pediatric services altogether, disproportionately affecting rural areas. Dr. Kenneth Michelson authored this study.
What we found was that hospitals have become less capable at taking care of kids over time. More than half of rural units actually closed over a 15-year period, which is just amazing and huge.
And in your opinion, what's the impact on children's health in those communities?
First is that if you're in a community, most likely pediatric hospital care is getting farther away from you. So if your child is really sick and needs to be hospitalized, you are likely to need to travel farther for that. I think the second clear impact is that it makes the overall system more brittle.
I'm listening to your heart.
General practitioners, they're okay for general things. But if you have kids, you want somebody who can see about a kid.
Right.
They're different. Their bodies are different.
If you retire today and no one replaced you, what would be the impact to this community?
I think it would be great in terms of, because I think you would have a situation where patients are scrambling to find someone to see their child quickly. And I think the scramble would be too large for the other practice to take on.
No pediatricians, no doctor, no urgent care.
After a long road to recovery, Markeisha's sons are now healthy and thriving, and she credits their pediatrician who was there every step of the way.
If you didn't have Dr. Mountain, where do you think your kids would be as far as?
I cannot imagine without Dr. Mountain.
Lungs sound clear.
Don't even make me think about it. I can't.